Welcome to the fall workshop of the Roundtable on Population Health Improvement. I'm Ray Baxter, and I'm one of the co-chairs of the Roundtable on Population Health Improvement, housed within the Health and Medicine Division of the National Academies of Sciences, Engineering, and Medicine. I welcome our virtual audience today and those who are viewing the recorded webcast of the workshop entitled Spatial Justice as a Driver of Health in the Context of Chronic and Acute Societal Emergencies. Although this will be a virtual workshop, it is being hosted from a physical location in Washington, D.C., the home of the National Academies and the Roundtable. For that reason, I would like to acknowledge and offer our deep gratitude and respect to the Nacotchtank Piscataway people and elders and ancestors, past, present, and future. Everywhere in the United States where our speakers and attendees find themselves at this moment, they are on the lands of Native American tribes and peoples. We lift up all of the ancestors who have struggled for justice. In their memory, we seek to help build a just future by centering health equity as the prerequisite to improving population health. Our roundtable recognizes that health and quality of life for all are shaped by interdependent historical and contemporary social, political, economic, environmental, genetic, behavioral, and healthcare factors. Therefore, the Roundtable seeks to provoke and catalyze urgently needed multi-sector, community-engaged collaborative action. One way we aim to do this is by hosting several public workshops each year that bring together different perspectives, disciplines, and sectors to explore and share what works to improve the conditions for equitable health and well-being in U.S. communities. A few words about the rationale for this workshop. As you are all aware, the Robert Wood Johnson Foundation and others have popularized the notion that a person's zip code matters more than their genetic code for their health. And the California Endowment has helped us recognize that health happens here, again, underscoring the relationship between places, spaces, and health. An understanding of the relationship between place, health, and health inequalities, one way to define spatial justice, is not new, of course. But we've all been paying more attention. We haven't and don't always pay attention to justice and injustice as a feature of places, spaces, and geography. These topics are not new either for the Roundtable or for the National Academies. The Committee of National Academies experts have examined spatial justice, advised the nation on matters related to housing, urban development, climate change, and health equity. The Roundtable has showcased numerous examples to inform action between people and places. These include community-related workshops on co-creating and stewarding inclusive, healthy places, and on framing the dialogue on race and ethnicity to advance health equity, which featured scholarship on the displacement and marginalization of racialized communities and subsequent harms and practice and policy, focused on place stewardship and placemaking by community members working collaboratively with planners and elected officials and funders and others. Today, we are continuing that series of explorations with a conversation about spatial justice and health against the backdrop of a pandemic and climate change crises that call on us to consider who lacks access to health promoting and protecting spaces and why, and approaches to address spatial injustice. It's fitting and ironic that we are discussing space in the time of COVID-19 because COVID has been all about space, where we can be and where we can't be, spacing ourselves apart from each other, sheltering in place, regardless of whether that space is safe, being a first responder, which inevitably means entering a dangerous space and being the first in a space, working remote or not, masking us from others in different spaces, measuring case rates in different spaces, declaring spaces safe or high risk or restricted, restricting our ability to travel to different spaces or enter different spaces. It's been all about space. So today's workshop was organized by a planning committee chaired by our valued colleague on the roundtable, Lourdes Rodriguez, and also includes Don Alley, Nupur Chaudhry, Alejandra Hernandez, Milton Little, and Monique Sosi. The planning committee was supported by our roundtable staff, Alina Bashu, Asia Coltrane, and Ali Andrade. Our agenda over the next 2 days is organized in 5 sessions. We begin with keynote presentations this morning that examine the history of spatial injustice and its legacies, and then progress to an exploration of climate change-caused harms and displacements, and then on to other built environment-related displacements. On Tuesday, we'll explore frameworks, approaches, and strategies for integrating a spatial justice lens for cross-sector collaboration and for decision-making. We'll conclude the workshop with all planning committee members reflecting on key themes and insights. If you're tweeting today, please follow at NASEM_health and follow the conversation by using the hashtag PopHealthRT.